Hey everybody, I'm Dr. Walt Jernigan with the New Mexico Junior College, and this is New Mexico Junior College. This is the view you see coming onto campus from the main entrance right off the Lovington Highway. This is Pennell Library. I am upstairs on the second floor of what we now call the University Center, and my office is in room 226. I teach most of my classes up there on campus. If you are taking the class in the traditional face-to-face version or an ITV offering, or maybe you're an online student visiting in the area, come by and see us. We'd like to see you. This is our course, PS113 Introduction to Psychology. This is the foundation course for all other areas of psychology. Most of you, I bet this will be the only course that you take. But if you're going to major in the area or in a related area, you're going to take a lot more courses. But I hope this will provide you a foundation no matter what your goals are. We're going to start with Chapter 1, Introduction to Psychology. And in these lecture captures that I'm going to be doing, the length will vary from 5 to 10 minutes, I think. We may go a little bit further, and then 10 minutes from time to time, but mostly in the 5 to 10 minute range, I think. And I will also start out the lecture giving you an overview of the important ideas we're going to cover. We're just going to do two this first time out. The first is the definition of psychology, and then the goals of psychology. And that'll be good for part one here. You ready to get started? Let's go. Here's a question for you. What is psychology and what do psychologists do? Think about that for a minute. I bet many of you said that, well, it has something to do with the mind, and you would be right. We're going to define it as the scientific study of behavior and mental processes. Now, I'm hearing some of you say, I get the bit about behavioral mental processes, but I didn't know it was a science. I thought you guys treated patients. I thought if you guys were good enough, you get your own TV show, you get to run around with Oprah. Well, it is true that a lot of us psychologists provide service to others, including me, your professor. I started out here at Lee Regional Medical Center just across the field from NMJC as chief psychologist at the hospital back in the mid-1980s through the mid-1990s, and in the pavilion and consulting on the med-surg floors. Later I worked at Guidance Center way across town, and also in the nursing homes. But this may come as a surprise to you that there are also psychologists out there who do research full-time, and they teach full-time, and they never see any patients. Maybe not like this guy with all the test tubes in the chemistry lab, but we all use the scientific method in everything we do, even when we treat patients. And I and any psychologist that you meet from here on out was first trained as a scientist, and we continue to think as scientists in all our professional activities. No matter what we do as psychologists, we are trying to meet the four goals of psychology. And these are to describe, explain, predict, and influence. And here's an example. How would you describe this woman's facial appearance? Her eyes are closed. She's got a sad, tense expression. She's holding her head in her hands. We could describe her as depressed, couldn't we? So that's the first goal of psychology, describing behavior and mental processes. If she is clinically depressed, how do we explain why? Well, there's several possible explanations, including a chemical imbalance in the brain, maybe loss and trauma, maybe she's lost a parent or a spouse. Could be thought patterns that are irrationally negative and totally unrealistic. If someone is clinically depressed, what can we predict might happen if they don't receive treatment? People who are seriously depressed are at higher risk to have family, school, and job problems, and to have suicidal thinking or even to hurt themselves. We can predict that this will happen in a percentage of patients, and so we're vigilant to observe for these complications. How do we influence a person with depression so that they can get back to their normal self and level of functioning? Pursuing this goal actually has a lot to do with the second goal of psychology, and that is explanation. If their depression is largely explained as a result of a chemical imbalance in the brain, the psychiatrist will undertake an evaluation for meds and probably start the patient on a trial of antidepressants. If, on the other hand, the depression is largely explained as the result of irrational thinking, the treatment plan will include a big emphasis on counseling to help this client restructure their thought patterns. So these are the 4 goals of psychology, and we usually address them in this order. They usually unfold in this order. And how best to describe, explain, predict, and influence behavioral mental processes for the betterment of the individual, for the family, the work setting, and even the community at large. These are the goals of psychology. In this short lecture, we've looked at definition of psychology and the goals of psychology. And that'll be it for now. We'll see you in part 2. Bye-bye.